Alima is 7 years old and dreams of becoming a doctor. She studies fervently and goes to school every day with excitement and hope. But this is not Alima. Alima cannot attend school or be with her family. She presented to Baseko Health Center with high-grade fever, chills, fast breathing, abdominal pain, vomiting, and some minor diarrhea. Since Baseko is not an endemic area for malaria, she was diagnosed with an acute gastroenteritis. However, after evolving to a critical condition, she was finally transferred to Gambo General Hospital. She had been misdiagnosed and hadn't received the treatment she needed until far too late. Alima is one of the countless victims of the global diagnostic gap. My name is Feven Jada. I am a medical doctor that works in Ethiopia in Gambo General Hospital. I always wanted to help people. I achieved what many children in Ethiopia couldn't. I fulfilled my dreams. But the reality that my patients endure is far too similar to a nightmare. Over the years, I've learned that our journey through this world is as fragile and fleeting as the flame of a torch. It's terrifying. I have learned the names of countless people who I have watched fade away, knowing that I could have helped them with the right resource. But I have also had the opportunities to work with so many health professionals that love what they do. Every day, I think of them and I feel a spark of optimism.
Welcome back.
But it is not enough for billion people. There is an Ethiopian proverb that says, when a spider web unites, they can't tie down a lion. When we come together, there is nothing we can't achieve. And no matter how fleeting it is, the flame of a torch can light others. This is Paul, a medical doctor who actually dropped out of his residency in neurosurgery with a firm conviction of tackling the global diagnostic gap. And Iñaki, a pediatrician who has been leading hospitals in Ethiopia for over a decade. Together, they connected the dots between a human need and a technological opportunity and decided to take action. MedBrain was born.
MedBrain is a clinical assistant, a co-pilot that guides healthcare professionals such as general practitioners, nurses, or health extension workers. It guides them through each one of the steps of the clinical process, including patient triage, diagnosis, and management. MedBrain thinks like a specialist doctor and asks a series of questions to help users navigate the clinical interview, anamnesis, and also the physical examination.
To me, I see MedBrain as a compass to make everyone's clinical practice safer and more efficient. When a health practitioner is faced with a difficult case, MedBrain will be their compass to guide them to the destination, which is ultimately healing the patient. Whenever there is a gap in clinical skills or knowledge, as long as MedBrain interviews is followed precisely, the users will know what to do with their patients at every moment, and they will not ever feel lost.
To save the life of a critical child, every minute counts. That's why MedBrain takes only 5 minutes to deliver an accurate diagnosis and a personalized step-by-step management plan, always based on the resources available within each different clinical setting.
MedBrain is currently focused on neonatal, infant, child, and maternal care. To build our medical library, we focus on 3 disease groups. First, the most highly prevalent disease, such as pneumonia, malaria, or neonatal sepsis. The second group, the low prevalence but highly severe disease, such as diphtheria, epiglottitis, or tetanus, that must be quickly identified with a clinical pattern. Finally, we focus on those diseases whose outbreak can be prevented with early warnings, such as cholera, measles, or meningococcal diseases.
We were witnessing it firsthand. MedBrain was being used effectively by nurses and health extension workers with a really limited clinical background. These results gave us hope that scaling our impact around the world may actually be possible. But we knew we couldn't do it alone. So we decided to create a blueprint, a replicable model of positive impact.
We partnered with Ethiopian Regional Government, the Oromia Health Bureau, and selected 50 health facilities, that is 25 health centers and 25 health posts, to implement MedBrain as their primary diagnostic resource. The blueprint for impact was a 3-step process. Step 1 was training. We gathered one healthcare professional from each of 50 health facilities. We trained them all together in 2 days intensive training program. The exam consists of 10 severe and complex cases that had to be diagnosed. Step 2 was implementation and peer-to-peer learning. Once the students passed their initial training program, they all went back to their local health facilities and trained their own colleagues. Step 3 was supervision and impact tracking. The area supervisors helped solve any issue that arose and were in charge of continuous testing of the new students. Before MedBrain's training program, only 12% of the clinical cases were diagnosed and managed correctly. After the training program, 93% of the clinical cases were diagnosed and managed correctly. Beyond capacitating healthcare professionals, our next step is tracking mortality reduction.
No one, no man, no woman, no child should ever have to get sick and not receive adequate health care and die from a completely preventable cause. We believe in a world in which every single human being receives the healthcare they need, and will continue to fight until that happens.